We presented the study Work Health and Care Literacy after the acute myocardial infarct. Myocardial infarction is one of the main cardiovascular complications and immediate treatment is essential, since the delayed care is associated to worse prognosis. The search for health care by people who have suffered a heart attack is related to way they experience and understand the illness and how much it affects their daily lives. When patients with heart failure have self-knowledge, they educate self-control or they design and manage self-care, avoid clinical complications that can lead to hospital readmission. Health literacy is defined in the process does not end with literacy, but is expanded view in health education. Health recognition and care taken by people who haven't suffered the aim with health literacy. The descriptive qualitative research comes from the master thesis Health is a city for west of Paraná, Brazil. Daily collection and analysis favored to May 2018. So this simple 12 adults. Collection data includes socio-demographic and clinical variables, participants' lifestyle, interview guide with an open question, and a file diary were used. The methodology used had content analysis based on the span proposed by Krasel. The lexical analysis was done through the participant reported from the fragment of the test corpus. The present truth table with the aid of Microsoft Excel 2010 inserts on the test corpus in the analysis software Eramutec. The analysis, pre-analysis, transcription the reading and the interview, the soft and deep understanding the central idea in construction the test corpus, organization of the corpus the software was used. The method exploration coding, the latest description in the interview, separation tests in small categories, and used the descent hierarchical classification named the corresponding class. Treatment and result interpretation, interpretation and understanding data based in analysis of the research literature. The result found was 81.42% of parameter composed of 6 classes and divided into two subgroups, which are named subgroups on knowledge and subgroups in care. In first knowledge subgroups, perceive the lack of the knowledge regarding the desires and the necessary care with their health at home, because there are reported fears and insecurities in the drugs therapy after discharge, feeling the angst and the anguish for to knowing how to deal with the changes imposed by the disease. The second group, in addition to not adherence to drug treatment, permissives it able to persist even after the diagnosis of the disease, worsening the clinical condition of the participant, as can be seen in the report to AP10. In conclusion, law health literacy directly related to people understanding of their use in their relationship with care, which influence the perception of this individual about this severity and consequently the search for health service. The methodology used allowed the broader within the data found. In addition, they make it possible to identify people's experience and representation and knowledge about these diseases.